Good evening. Every year, in the month of March or around this time, there is a sudden spurt in the viral cases like the cough, cold, fever type of cases. You can check in 2020, 2021, 2022 and now 2023. Though the COVID was more or less gone after the 2022, but we have seen a lot of flu cases. The people who are coughing for a long time, fever with a very high grade. Ultimately, we have seen that these are the different strains of flu. It was the H3N2 or other type of virus, influenza or flu cases. Subsequently, along with this different variants of flu, we are also seeing a rise in the COVID cases. Now we need to understand COVID is also a COVID, now is termed as a COVID flu because the symptoms are similar to the flu. High grade fever, cough, cold, body ache, sometimes loss of smell and loss of taste, and sometimes you can also get the loose motions, vomiting and the stomach pain. Most of the patients, more than 99% of the patients, settle down with the symptomatic and supportive treatment. So whatever the media says, the H3N2 or the rising in the COVID cases, though it is there, we are seeing the rise in COVID cases. We are seeing every day now few cases COVID coming back after a gap of almost 1 year. But there is nothing to worry. You continue to take your precautions. You can raise your guard again. You start wearing mask whenever you are getting out of the house, whenever you are entering into a crowded area, you are going through the airports, on the public transports, and maintain social distancing and do a proper hand hygiene. These are the main measures which were taught during the time of COVID, remain still gold standard. But even if you get COVID, it is going to get into your family. The entire family is going to suffer. Everybody is going to have a cough, cold, fever, but most of the time the symptoms will settle down. With this new variant, the H3N2 variant, you will have an illness which is lasting for a little longer time, maybe up to a period of few weeks. The fever which is higher in the first 1 week, but most of the symptoms will settle down. Hardly anybody will require hospitalization, but still we don't need to take this as a light, and we need to take all precautions. As I told you, all the appropriate, I would not say now the COVID appropriate behavior, I would say the flu appropriate behavior, because COVID is also termed as a flu. So take flu appropriate behavior and make yourself healthy and safe. Thank you very much.